Welcome back to Houston Life.
It is Childhood Cancer Awareness Month, and today we're taking a look at how a local clinic is helping to protect kids from pediatric cancer. The Childhood Cancer Prevention and Screening Clinic at Texas Children's Hospital is a first of its kind in the country. The clinic supports families of children with genetic conditions that make them more likely to develop pediatric cancer. Using the latest screening methods, the clinic identifies tumors sooner, allowing for treatments to be implemented earlier and ultimately saving lives.
And joining us now from Texas Children's Hospital, Dr. Surya Rednam, founder of the Childhood Cancer Prevention and Screening Clinic, Sarah Scollin, lead genetic counselor, and 16-year-old patient Aiden Mohammed. Welcome to all three of you. Aiden, we're going to hear more about your story in just a moment. Dr. Surya Rednam, though, I want to ask you about the clinic that you founded. How did this all begin, and what really is the purpose?
Well, this clinic all started with a growing number and knowledge of patients, children that we know are at very high risk for developing childhood cancer. And when we know in advance that someone has a condition that places them at high risk for cancer, we want to be able to screen them for those cancers so we can identify those cancers early and treat them early.
And this would be sort of a long-term process, right? Once those markers are identified, these patients pretty much stay with you and the clinic for their lifetime.
Exactly. As long as they're children and adolescents, we continue to follow them in our high-risk clinic.
And Sarah, when did you first meet Aiden?
I met Aiden probably, we were just talking maybe 7 years ago. So he was, or 8, you were 7 when I met you. So quite a while ago.
So it's been a long journey.
Yeah.
16 years old now, Aiden. In second grade, you were having some symptoms. You were feeling a little bit off. Describe to us what happened.
Well, I was getting like severe headaches, and my mother noticed that I was acting out of character. And that's what was the symptoms I was having.
And you're a young person, so just turned 16, just got your license, congratulations, all the good things. When you look back at the journey that you have gone through with the people here on the sofa, right? They become part of your family. What have you learned and going through all of this?
Well, mostly that you could, something could happen in a second, and you never know what's going to happen and never know if you're going to make it, but you got to have confidence that you're going to make it through whatever you're going through.
And Sarah and Dr. Rednam, in Aiden's case, all of the symptoms he was experiencing, they were a result of a tumor that was discovered. That tumor has since been removed. But talk about families who find themselves in situations like Aiden's, where you are able to do the genetic testing and essentially create a roadmap of this child's health or predicted health down the road.
Yeah. So usually where they start is there is some suspicion that there's a condition that may predispose them to developing a cancer. So at that point, they're referred to our cancer genetics clinic. They will meet with, so our director, Dr. Sharon Plon, she's an internationally recognized geneticist, along with a member of our genetic counseling team. And we'll do an evaluation that includes things like collecting family history, medical history, a clinical exam to really come up with a personalized risk assessment and determine if genetic testing is right for the family along with the family. When we do identify a genetic condition, we are then able to sit down with the family. We can go through in detail what that condition is, what the screening might look like. We also often test multiple family members to see if anyone else is at risk. And then it's really at that point that we'll refer on to the Cancer Prevention and Screening Clinic with Surya and his team, or Dr. Redmond and his team.
And Dr. Redmond, I can imagine, having this so specific for families like Aiden's and to have this information, the testing, but also the research that's being done. So now, the following up and everything that's being recorded as part of this clinic can hopefully eradicate whatever we're dealing with.
That's our hope, is that we continue to improve our ability to identify these tumors, these cancers in our high-risk children over time, as well as over time be able to prevent these tumors and cancers from even developing in the first place.
And oh, go ahead, continue.
So we and others across the country, across the world, are all working together to achieve those goals.
It is phenomenal, and it's great that, we have Texas Children's here in our backyard, the fact that people travel here from all over the world to get medical care. Aiden, I can imagine that it's not good news at any age to hear that you have a tumor. That must have been a terrifying experience for you back then, but look at you now, 16, as Courtney just mentioned, you got your driver license. How are you feeling today?
I'm feeling great, much better than I was when I was 7, I would say. So, yeah, thanks to them, I'm able to, live out my dreams.
Well, that is phenomenal. We're so glad to know each one of you. Dr. Rednam, Sarah, Aiden, thank you so much for stopping by Houston Life, and continued good health.
Thank you.
We'll see you again. Thanks.
And to learn how to support childhood cancer research, please visit Texas Children's website and click Ways to Give.
And you can find more information by visiting our website, HoustonLife.tv. Just look for that scene on Houston Life section. There's a link right there.